1 in 10 people reading this right now is hearing a sound that doesn't exist. Not outside, not a car, not a neighbor, not the TV. Inside. A high-pitched whine. A low drone like electrical equipment in the walls. A ringing that doesn't stop when you press the pillow over your ears. And here's the number that should make your blood run cold. 90% of people who go to a doctor about this problem walk out with eardrops. Eardrops that will never work. Not because the doctor is incompetent, but because they're looking in exactly the wrong place. Your ears are fine. The problem is in your brain, and I'm going to prove that to you right now. Subscribe and hit like. We're working toward 1,000 subscribers, and I need your help to get there. What you're about to learn is being systematically withheld from you. The healthcare system profits when you keep coming back. It doesn't profit when you get better and stop coming. That's the reality. I'm Sam Waterling, and I've spent 15 years watching this exact mistake play out in real patients. Let me paint you a picture. It's evening. You're tired from work. You turn off the television, kill the lights, and all you want is to fall into bed and disappear into sleep. The house is quiet. The street is quiet. But the moment you close your eyes, someone inside your skull flips a switch. For some of you, it's a thin, piercing whine, like an old CRT television warming up. For others, a low, heavy hum, as if a transformer is running behind the wall. For others still, it sounds like crickets in a field or ocean surf, except it doesn't calm you down. It drives you insane. You roll to the other side. The sound doesn't move. You pull the blanket over your head. It gets louder because it's not coming from outside, it lives in you. And that's when the real enemy arrives. Panic. What if this is permanent? What if something ruptured? Am I losing my mind? Your heart speeds up. Your blood pressure spikes. Sleep is gone. I know many of you just recognized yourselves in that description. Strong men and women come into my clinic and cry. Not from pain, but from this sound. It grinds you down harder than any physical injury. It won't let you concentrate during the day and won't let you recover at night. In 15 years of practice, I've seen tens of thousands of patients with this exact complaint. And I'll tell you directly, the vast majority of them were treating the wrong thing in the wrong place. Put down the eardrops. Stop searching terrifying diagnoses online at 2 in the morning. Take a breath. What I'm about to say may change everything you think you know about this condition. The number one mistake made by 90% of patients, and unfortunately by many of my colleagues, is treating tinnitus as an ear disease. That's the medical term, tinnitus. It means ringing or noise in the ears with no external source. Doctors prescribe ear irrigation, ear insufflation, antibiotics, vasodilating drugs. The patient completes the course, spends the money, and the ringing stays. Or it goes quiet for a week and comes back stronger than before. Why does this keep happening? Because in the overwhelming majority of cases, your ears are completely healthy. The eardrum, the tiny bones inside the middle ear, the ear canal itself, they can be in perfect working order. Tinnitus is not an ear disease. It's an alarm signal. It's a symptom. It's your brain screaming for help. Let me explain the neuroscience in plain language. Imagine you're a sound engineer at a concert. You have a microphone, that's your ear, and you have speakers, that's your brain, processing the signal. When the microphone is working well, it picks up everything around it, sends a clean signal to the console, and you hear clear music. But now imagine the cable from the microphone gets pinched somewhere, or the microphone itself starts picking up a weaker signal because of age, inflammation, or disrupted blood flow. The signal becomes faint. What does the smart engineer, your brain, do? It doesn't say, fine, we'll just hear less. No, it cranks the volume knob all the way up, trying to pull that weak signal into the audible range. It amplifies the sensitivity of the auditory centers to their absolute maximum. And what happens when you crank the volume to maximum in a quiet room? You get background noise, hissing, humming, electrical static. That static is exactly what you hear at night. This is called a phantom sound. Your brain has not lost its mind. Quite the opposite. It's working too hard. It's trying to compensate for a lack of incoming information by generating its own signal. The same principle behind phantom pain. A person loses an arm but still feels it itching. Your auditory nerve is itching. But why does the signal become weak in the first place? Why does the brain decide to switch on this alarm? Here is where the critical trap lies. People think, It's ringing. That means the nerve is dying. I'm going deaf. Soon there will only be silence. That belief drives people into depression, and it is a myth. The real reasons your brain activates this protective mode number in the dozens. And the majority of them have nothing directly to do with your auditory system at all. I see this pattern constantly in the clinic. A patient comes in complaining of ringing. We run an audiogram, the hearing test that measures what frequencies you can detect. The result is normal, ideal for their age, but the ringing is still there. We dig deeper and find a problem in the neck, or in the jaw joint, or a straightforward deficiency of specific micronutrients, minerals, that leaves the nervous system in a state of chronic overexcitation. Your brain is an extraordinarily energy-hungry organ. If it isn't getting enough fuel, meaning blood, oxygen, glucose, or if venous drainage is impaired and waste-filled blood is pooling, the brain starts to panic. And tinnitus is partly the sound of turbulent blood flow through narrowed vessels, which your overexcited brain amplifies tenfold. You are not hearing the street outside. You are hearing the machinery of your own body, the same machinery that a healthy brain silently filters out. A healthy brain has a powerful internal filter. It says, heartbeat, irrelevant. Sound of breathing, irrelevant. Joints creaking, ignore. But when the nervous system is exhausted by chronic stress, sleep deprivation, or pain, that filter breaks down. And suddenly, you're left alone with the entire internal orchestra of your own body. That is exactly why taking pills for your ears is like putting a piece of tape over the flashing check engine light on your car's dashboard. You might cover the light, but the engine isn't going to run better because of it. I want you to understand one thing right now. Tinnitus is reversible. If we can identify where the cable is pinched or where the filter broke down, we can restore the original settings. The silence can return. But to do that, we need to properly classify what's going on. Right now, I'm going to walk you through the 4 types of tinnitus. And pay close attention. Only one of them is genuinely dangerous and may require complex intervention, including surgery. If you recognize yourself in the other 3 types, consider yourself fortunate. We're going to address this without a scalpel, without a hospital, using your own hands in your own home. Let's become detectives. To defeat an enemy, you need to know its face. The noise sounds different for everyone, and your job is to listen carefully and understand which of the 4 categories fits you. This matters critically because the treatment that works for type 1 is completely useless for type 3. Type 1, vascular or pulsatile tinnitus. This is the most mechanical variety. Patients describe it this way. Doctor, I can hear my heartbeat inside my ear. This sound pulses in rhythm with your pulse. Your heart speeds up, the noise speeds up. You calm down, it slows down. Sometimes it sounds like a whooshing. Swish, swish, swish. What is happening? This is the sound of turbulence. Under normal conditions, blood flows through vessels quietly, like a wide, calm river. But if the channel narrows somewhere, from an atherosclerotic plaque, or far more commonly from a muscular spasm in the neck that has compressed the vessel, the blood begins to swirl and beat against the walls. And you hear that beating because the carotid and vertebral arteries pass within literal millimeters of your auditory apparatus. If you are hearing your pulse, it's the vessels. Full stop. Type 2, muscular tinnitus. These sounds are highly specific. Clicking, crackling that resembles popping bubbles, or an extremely rapid tapping, similar to fluttering wings or a distant machine gun. This noise is not constant. It can appear during swallowing, during yawning, or spontaneously. What causes it? Inside your ear, there are tiny muscles. The smallest muscle in the entire human body is the stapedius, the muscle attached to one of the 3 tiny bones inside your ear, and the tensor tympani, the muscle that tightens the eardrum. When you are under chronic stress, when you are deficient in magnesium, or when there is an issue with the facial nerve, these muscles begin to twitch. This is a tic. Just like an eyelid twitches, a muscle inside your ear can twitch. You can see the eyelid twitching in a mirror. You hear the ear muscle twitching as clicking or crackling. Type 3, sensorineural or subjective tinnitus. This is the most frequent visitor to my clinic. This is the classic monotone, high-frequency whine, ringing, whistling, like a television left on or an ultrasonic alarm. It doesn't pulse, it doesn't click, it just buzzes on one note. sometimes quieter, sometimes louder. This is phantom sound, damage to the hair cells of the cochlea, which is the spiral-shaped inner ear structure responsible for converting sound vibrations into nerve signals, or overexcitation of the auditory cortex of the brain. It is an electrical signal, a software malfunction, not a hardware failure. This type is most often confused with vascular tinnitus and treated incorrectly, with patients receiving IV drips of medications that do nothing to address the real problem. Type 4, psychogenic tinnitus. This is the trickiest one. Patients say, sometimes it rings, sometimes it hums, sometimes it sounds like distant voices or music. The sound changes with my emotions. You got stressed, it started droning. You got absorbed in an interesting film, silence. Here the problem is not in the ear and not in the vessels, but in the limbic system of the brain, the part responsible for emotional processing. The brain is locked in a state of chronic anxiety and interprets every bodily signal as a threat. Now that you have a rough idea of your type, I have an obligation to address the red flags. I am a physician, and my first rule is do no harm. There are situations where you should not be doing exercises and self-care. You should be at an MRI scanner. Listen carefully. You need to seek immediate evaluation if your tinnitus is strictly one-sided. If only your right ear rings while the left is completely silent, or vice versa, that is a reason to have your auditory nerve examined for growths called neuromas. Don't panic prematurely. This is rare, but it must be checked. The second red flag, tinnitus accompanied by severe vertigo. Not a slight feeling of imbalance, I mean the room spinning around you with nausea. Third flag, sudden hearing loss. You heard normally yesterday, you woke up today and the ear is muffled and ringing. This is acute sensorineural hearing loss, the medical term for sudden damage to the inner ear's ability to function. Time matters here. You have a window of 3 to 5 days to save your hearing with corticosteroid therapy. Go to an ear, nose, and throat specialist immediately. Fourth flag, neurological symptoms. If along with the ringing your face droops, your vision doubles, or your speech becomes slurred, call emergency services. Now, no delay. If none of that applies to you, if the sound is bilateral or inside the middle of your head, if it has been with you for a while, if there is no significant vertigo, breathe out. We have ruled out the serious possibilities. Your life is not at risk. But here's the question I hear constantly. Doctor, I figured out I have vascular or sensorineural tinnitus. I went to a doctor. They gave me IV infusions of vinpocetine, Mexidol, vitamins. I took betahistine for 3 months. Zero effect. Why doesn't anything work? Let's use logic. Imagine a garden hose with someone's foot standing on it. Water trickles through in a thin stream and the hose vibrates under the pressure. What IV medications try to do is make the water thinner. They improve blood flow properties, reduce viscosity. That's not without value, but does it lift the foot off the hose? No. Until you mechanically remove the pressure, no chemistry will help. If the vertebral artery is compressed by a spasm neck muscle, if venous drainage is blocked by years of slouching, the medication simply cannot reach its target in the necessary volume. You are treating the consequence while completely ignoring the gross mechanical cause. The ear is an organ that depends enormously on biomechanics, on the position of your head, the state of your jaw, the tension in your neck. And here I want to tell you about one patient. Andrew, 45 years old, a long-haul truck driver. A tough man, the kind who repairs engines on a highway in below freezing temperatures and runs on 3 hours of sleep. But the day he walked into my office, he looked completely crushed. He placed a bag of medications on my desk. Everything was in there. Vasodilators, nootropics, drugs that are supposed to support brain function, antidepressants, B vitamins in doses large enough for an elephant. Doctor, he said quietly, I can't do this anymore. During the day I manage. The sound of the engine covers it up. But when I stop for the night and the cab goes quiet, it starts. A whistle like a kettle about to boil inside my skull. I haven't slept properly in 3 months. My wife says I've become aggressive. My dispatcher is threatening to let me go because I'm losing focus. The neurologist at his local clinic had told him, what do you expect, Andrew? Cervical osteochondrosis. That's degenerative disc disease in the neck. Age-related changes, worn vessels, learn to live with it. Learn to live with it. Those are the most devastating words a tinnitus patient can hear. How do you learn to live with a siren running inside your head, around the clock, every day? Andrew brought me a stack of imaging reports as thick as a novel. MRI of the neck, MRI of the brain, audiograms. Everywhere the same conclusion. Age-related changes, vascular insufficiency. Come to terms with it. At 45 years old, I looked at his scans. Then I looked at him, and I asked him to do one simple, seemingly ridiculous thing. Not with his head, not with his neck, but specifically with his jaw. And you know what happened? His eyes went wide. The sound changed tone instantly. The thin whine became a dull drone, and then, for a moment, vanished completely. In that moment, we identified the true cause of his suffering, the one that not a single MRI had found. Let me explain the mechanism. Andrew sits behind a wheel for 10 to 12 hours a day. Head pushed slightly forward, hands on the wheel, shoulders tensed, teeth clenched from concentration on the road. This is forward head posture syndrome, and it doesn't only affect truck drivers. It affects every office worker, every programmer, every accountant, anyone watching this right now who sits with their head over a screen. Inside your cervical spine, your neck vertebrae, run the vertebral arteries. These are the main blood supply lines for the posterior parts of the brain, including the centers of hearing and balance. When Andrew sat with his neck extended forward, his vertebrae shifted and began compressing these arteries. The neck muscles turned to stone from sustained static tension and became a vice. Blood could not flow freely. It forced its way through the compressed segment with turbulence. That turbulence is the sound of your own blood hammering against vessel walls next to your auditory nerve. But that is only half the problem. There is a second cause that almost no one talks about. I call it the neighbor effect. The temporomandibular joint, TMJ, the hinge that lets you chew, and the middle ear are neighbors sharing a wall. The bone between them is sometimes no thicker than a sheet of paper. Beyond that, they share nerve supply. The nerves controlling the chewing muscles and the nerves going to the muscles inside the ear are deeply intertwined. Andrew admitted that he clenches his jaw while driving. Stress, a difficult road, someone cuts him off, the jaw locks automatically. This is bruxism, unconscious teeth clenching. When the jaw muscles, especially the deep pterygoid muscles, go into spasm, they compress the eustachian tube and exert mechanical pressure on the eardrum. The brain receives a distorted signal. Imagine your neighbor starts drilling through the shared wall. You can't see the drill, but you can hear it. That's exactly what the auditory nerve does. It hears the tension in the jaw and neck muscles and interprets it as a high-frequency whine. This is called somatosensory tinnitus. Tinnitus driven by the body's muscles and joints, not by damage to the ear itself. We did not prescribe Andrew another round of IV drips. We did something he never expected. We started working with his neck and his jaw. I showed him how to release the deep muscles beneath the base of his skull and how to reduce spasm in the chewing musculature. After the very first session, when we mechanically lifted the foot off the hose and restored blood flow, the sound changed. It became quieter, duller, lost its sharp edge. Within 2 weeks, Andrew slept through the night without sleeping pills for the first time in 6 months. We addressed the cause, not the symptom. We gave the brain proper nourishment, and it no longer needed to compensate by manufacturing phantom sounds. But how do you know whether your own tinnitus is coming from the neck or the jaw? An MRI won't tell you. A muscle in spasm doesn't light up red on a scan. Right now, I'm going to run a quick 3-step test with you. It will take exactly 1 minute. And remember the golden rule. Tinnitus that changes with movement is good tinnitus. Why? Because if you turn your head and the ringing shifts, louder or quieter, it means your auditory nerve is alive. It's simply being confused by signals from your muscles and vertebrae. This is called somatic modulation, and it is treatable. What's concerning is when you could stand on your head and the sound remains perfectly flat and unchanging, like a dial tone. Do everything slowly and gently. If you feel pain, stop. Test 1, the neck and vertebral artery syndrome. Sit up straight. Drop your shoulders. Slowly turn your head to the right as far as it will comfortably go. Place your right hand against your cheek and gently, very carefully, Press your head against your hand, creating resistance. Your neck muscles contract. Now listen to the noise. Repeat to the left. Turn, press cheek to palm, engage the neck muscles. Then, if you have no dizziness, tilt your head back and look at the ceiling. Then slowly bring your chin down toward your chest, stretching the back of the neck. What happened to the sound? For many of you, at the point of maximum rotation or flexion, the ringing sharply intensified or shifted in tone. If so, congratulations. Your tinnitus has a cervical or neck-based origin. You just mechanically compressed already spasmed muscles, blood flow accelerated, and the microphone in your ear picked it up. The problem is not in the ears, it is in the deep extensors of the neck. Test 2, the jaw joint or TMJ. This test frequently shocks patients. Open your mouth as wide as you can, the way you do at the dentist. Hold for 5 seconds. Now clench your teeth firmly, hard enough to feel the jaw muscles bulge. Then push your lower jaw forward, like a bulldog. Hold that position. Listen. If at the moment of clenching or pushing the jaw forward, the ringing increased or became sharper, welcome to the club of hidden bruxism. You have temporomandibular joint dysfunction. The joint head of the jawbone is pressing against the ear canal and the middle ear cavity. The ligament that connects the jaw to the malleus, one of the 3 tiny bones of the middle ear, is under excessive tension. You have been treating your ear. You need to be releasing your chewing muscles. Test 3, the doorbell button, the trapezius muscle. Place the opposite hand on your shoulder, near the base of your neck. Find the hardest, most painful point there. This is the upper portion of the trapezius muscle. In almost every working adult, it is tight as a board from chronic stress. Find that painful nodule and press firmly into it with your finger. Hold for 10 seconds. For many people, tinnitus will begin to pulse or intensify in sync with the pressure. This is referred pain and referred signal. A trigger point, an area of concentrated muscular tension, inside the muscle sends a false impulse to the brain, and the brain misroutes it and activates sound in the ear. Breathe out. Put your hands down. You now understand your own diagnosis better than 80% of clinicians who simply look into the ear canal with an otoscope and say, "Looks clean." You just demonstrated to yourself that your tinnitus is mechanical. But there is something else I want to share, something ENT doctors stay silent about because it is genuinely not their territory. We found the mechanical cause, a compressed neck or a tense jaw. But why does the nerve react so intensely to it? Why does your neighbor have neck pain too, but perfect silence in their ears, while yours is a full symphony orchestra? There are hidden, invisible enemies attacking your hearing. The first, chronic spasm of the short extensors of the neck. These are tiny muscles directly under your skull connecting the first cervical vertebra, the atlas, to the occiput, the back of the head. The vertebral artery passes through exactly that region before it enters the skull. In the era of smartphones, all of us spend hours with our heads tilted down. These muscles have been in a stretched, overloaded state for years. They harden like rock and develop the consistency of scar tissue. The artery there is essentially being strangled. Until we soften that area, no pill will reach the brain in adequate supply. The second hidden enemy, and this will surprise you, is insulin resistance. Doctor, what does sugar have to do with this, you'll ask? The auditory nerve and the hair cells of the cochlea are among the most energy-demanding structures in the human body, and they are also the most sensitive to blood glucose levels. When you eat a diet high in sugar and refined carbohydrates, bread, pastries, sweetened drinks, insulin spikes repeatedly. Chronically elevated blood sugar acts like sandpaper on your vascular walls. It degrades the myelin sheath, that is, the insulating coating around nerve fibers that allows signals to travel cleanly, the same way rubber insulation protects a wire. Strip the insulation off a live wire, and what do you get? Sparks, short circuits, noise. High blood sugar causes glycation, the biological process of sugar molecules bonding to proteins and damaging them. Your vessels become fragile and narrow. The nerve is exposed. Sensorineural hearing loss is becoming dramatically younger as a condition, and the primary driver is diet, not headphones and loud music. So when a patient comes in with tinnitus, I don't only look at their neck. I look at their midsection and I ask, what did you have for breakfast? If the answer is a pastry and a large sweet coffee, we've found one of the culprits. Now, let's talk about what you are probably doing wrong every single morning. 2 habits that seem completely harmless but are destroying your hearing faster than a rock concert. Habit 1. You wake up and the first thing your hand reaches for is the coffee maker. I am not going to demonize coffee. I drink it myself. But there is a rule that neurologists know and forget to communicate to tinnitus patients. Caffeine on an empty stomach is a punch to your vascular system. You wake up in the morning and your cortisol, your primary stress hormone, is already naturally elevated to help you get out of bed. You drink a strong black coffee on an empty stomach. This triggers an abrupt, powerful spasm of peripheral blood vessels. And we have already established that your neck vessels are already compressed by muscles or vertebrae. Caffeine delivers the finishing blow. Blood flow to the cochlea and the auditory nerve, which should have been recovering overnight, is cut off again. Instead of energy, you get intensified ringing 30 to 40 minutes after breakfast. My recommendation: never drink coffee on an empty stomach. Wait 30 to 40 minutes after eating. And add cream or whole milk. The fat blunts caffeine absorption and softens the vascular impact. Habit 2. Your pillow. Patients tell me regularly, "Doctor, during the day it's manageable, but I wake up in the morning with a leaden head and ringing like a factory floor." I ask them to show me how they sleep, and I see the same thing every time. A high, plush, luxury pillow. When you sleep on that kind of pillow, your neck is bent at an angle and your chin is pressed toward your chest. In that position, the vertebral arteries, which run inside the bony tunnels of your neck vertebrae, are mechanically kinked. For 7 to 8 hours every single night, your brain is in a state of mild hypoxia, oxygen deprivation. The auditory nerve, which is extraordinarily sensitive to oxygen levels, begins to suffer. You wake up and the brain, in a state of mild emergency, activates its alarm. That alarm is your morning ringing. The solution? An orthopedic pillow or a cervical roll. Your head should be in a straight line with your spine. This is not a luxury. For anyone who wants to protect their hearing, it is a necessity. The third enemy, the cotton swab. Let me be absolutely clear. Your ear canal is self-cleaning. Earwax is not dirt. It is protection, an antimicrobial, waterproof barrier the ear produces on purpose. When you aggressively clean your ears with a cotton swab every morning, you are doing 2 harmful things. First, you are pushing wax deeper toward the eardrum, creating a dense plug that presses against the eardrum and causes tinnitus. Second, you are irritating branches of the vagus nerve that run through the ear canal. This triggers a reflexive cough and aggravates the ringing. Throw the swabs out. Wash the outer ear only with a fingertip in the shower. That's it. The fourth enemy, in-ear earbuds, especially the rubber-tipped vacuum seal type with active noise cancellation. When you insert a rubber plug into your ear canal, you create a sealed chamber with no air cushion. Sound waves hit the eardrum directly with nowhere to dissipate. It's equivalent to shouting into a bucket placed over your head. The pressure on the hair cells is enormous. If you cannot live without music, buy over-ear headphones. The air gap between the driver and the eardrum makes a critical difference. Good, we've evicted the enemies. But stopping the damage is not enough. We need to feed the nerve so it calms down and stops generating static. We need the biochemistry of silence. The first and most important ally, water. Obvious, but effective. Thick, viscous blood cannot navigate the capillaries of the inner ear. Those blood vessels are thinner than a human hair. If you are chronically underhydrated, your auditory apparatus is suffocating. A glass of warm water in the morning before coffee activates lymphatic flow and reduces blood viscosity better than aspirin. The second ally, magnesium. This is the body's primary relaxation mineral. It relieves spasm in small muscles and small vessels. But do not run to the pharmacy for cheap magnesium oxide. It doesn't absorb well and will give you nothing but digestive discomfort. Look for chelated forms. Magnesium glycinate if poor sleep is an issue, or magnesium citrate if constipation is a concern. Take it in the evening. It will calm the electrical storm in the nervous system before sleep. The third ally, B vitamins. Vitamins B1, B6, and B12 are the insulation repair crew for your nerves. They rebuild the myelin sheath so that signals travel cleanly without interference. But note, The active coenzyme forms work significantly better than the standard pharmaceutical versions. For example, not cyanocobalamin, methylcobalamin. These are utilized immediately and go to work even if your stomach acid or gut absorption is impaired. The fourth ally, fatty acids. The human brain is 60% fat by weight. The myelin sheath around a nerve fiber is fat. If you have been following a low-fat diet, your nerves lack the raw material to rebuild insulation. Omega-3 fatty acids, quality butter, olive oil, avocado. Fats are essential for the flexibility of the cell membranes inside the ear. A dry cell is a dying cell. So we eliminated morning caffeine on an empty stomach, changed the pillow, discarded the cotton swabs, started drinking water, and added magnesium and quality fats. You will feel your body respond. The brain fog will lift. But the sound is still there, isn't it? Quieter, softer, but not gone. Why? Because we have prepared the ground, removed the aggressive factors, provided nourishment, but we haven't pressed the reset button yet. Muscle memory is stubborn. Your neck and jaw muscles have spent years learning how to be tense, and vitamins alone won't persuade them to let go. They need a direct command to release. They need a mechanical reboot. I promised you exercises. This is what I use personally when I feel ringing after a long shift or a long flight. My personal gold standard, a mini protocol that takes exactly 3 minutes. You can do this at your desk, in your car, before sleep. Set everything down. Sit straight, back upright, crown of the head reaching toward the ceiling. Step 1, the master key, the sternocleidomastoid muscle. Many people go straight to the ear, but the work begins elsewhere. Remember the foot on the hose analogy? The main compression site is the neck. Turn your head to the left. See that powerful cord of muscle running from behind your ear down to your collarbone? That is the SCM, the sternocleidomastoid. It is the primary culprit in vascular tinnitus. In 99% of people with this condition, it is rock hard, and it is directly on top of the neurovascular bundle, the cluster of arteries, veins, and nerves feeding your head. Technique: do not stroke it, capture it. Using a pinch grip, thumb and index finger, grasp the belly of the muscle in the middle of the neck. Pull it gently away from the artery. Painful? If you feel the urge to wince, we have found the source. A healthy muscle is painless to the touch. Now use a kneading rolling technique and work your way down from the mastoid process, the bony bump behind the ear, all the way to the collarbone. Do not press on the carotid pulse. Work only the muscle. You will feel warmth spreading through the face and ear. That is blood moving. You have opened the valve. 3 to 4 passes on each side. The sound may already change tone and become duller. Step 2, the key point. Ting gong, small intestine 19. Now that blood is moving toward the head, we work the microphone itself. There are dozens of acupoints used in traditional East Asian medicine, but for tinnitus, there is one that stands above the rest. This is Ting gong, translated as palace of hearing. Many people miss it by a centimeter and press against bone, which is useless. Here is how to find it precisely. Place your index finger directly in front of the tragus, the small flap of cartilage that projects over the ear canal opening. Now slowly open your mouth. Feel that? A deep notch is formed under your finger. When you close your mouth, the joint pushes the finger out and the notch disappears. We need that notch, with the mouth slightly open. Gently part your lips, place your index fingers into these depressions on both sides simultaneously. Begin circular massage with firm, intentional pressure. You are not rubbing the skin, you are reaching the deep structures. You should feel a sensation of fullness, possibly a pleasant deep ache radiating into the ear canal. Perform 20 rotations clockwise, then 20 counterclockwise. You are directly stimulating blood flow to the middle ear region and releasing tension from the joint capsule of the TMJ. Step 3, heavenly drum. This is an ancient Taoist technique, and it looks peculiar, but its effectiveness has been validated across centuries of practice and by modern research into bone conduction. It functions as vibrational massage for the hair cells of the cochlea. The cochlea is a fluid-filled structure. When the fluid becomes stagnant, the cells suffer and generate noise. We need to create a wave. The technique: press your palms firmly over both ears so that your fingers rest on the base of your skull. Fingers pointing toward each other. Place your index fingers on top of your middle fingers. Now snap the index fingers off the middle fingers, striking the back of the skull, the occipital bone. From outside, this produces a soft click, but inside your head, through bone conduction, the transmission of sound vibration through the bones of the skull, this lands like a resonant drum beat. Perform 12 to 24 strikes in a steady rhythm, eyes closed. This resonance agitates the stagnant fluid in the inner ear and relaxes the tensor tympani muscle, the muscle that controls eardrum tension. When you lower your hands afterward, you will experience a remarkable velvety quiet. The contrast will be striking. Now for the most important detail. Without this, everything above works at half power. I need to warn you, most people perform these exercises incorrectly and get only 15 minutes of relief before the ringing returns at full force. Why? Because there is one critical breathing mistake that 90% of people make. Think back, when you were pressing the point or striking the back of your skull, you held your breath. You concentrated, you tensed up, and you stopped breathing. And in that exact moment, you canceled out half the benefit. Tinnitus is always a state of overexcitation. Your brain is running at high RPM. Your nervous system is in fight or flight mode. When you hold your breath during massage, you increase intracranial pressure, the pressure inside your skull. You are telling the brain, danger, tighten further. You are mechanically releasing a muscle while biochemically pressing harder on the accelerator. There is a direct conflict. So remember, all exercises for the ears, whether neck massage or point stimulation, are performed exclusively on a long, slow exhale. This is the physiology of the vagus nerve, the body's primary relaxation pathway. Inhalation activates arousal. Exhalation activates inhibition and recovery. We need inhibition. When you press Ting Gong, take a calm nasal inhale over 4 counts, begin the circular movement, and slowly exhale through the mouth as if you are gently extinguishing a candle over 6 to 8 counts. The exhale must be longer than the inhale. It is precisely on the long exhale that your brain flips the switch from threat, ringing, to safety, silence. This physiological shift lowers cortisol, the stress hormone that, in chronically elevated amounts, directly damages the auditory nerve. The formula: mechanics, the exercises, plus biochemistry. Magnesium, water, correct nutrition, plus breathing equals silence. Remove any one leg and the table falls over. Your daily mini protocol broken down by time of day. Morning, lymphatic wake up, 1 minute. While brushing your teeth or washing your face, rub your outer ears briskly between your palms until they feel warm. Tug the earlobes upward, downward, backward. Give the sternocleidomastoid muscle a brief kneading massage to open drainage of the blood that pooled overnight. Daytime, emergency reset, 30 seconds. Stress at work, someone spoke harshly, the ringing spiked. Slightly open your mouth, locate the Ting Gong point. Massage for 20 seconds on a long, slow exhale. This releases the jaw muscles. The sound will ease. Evening, deep reset, 2 minutes. Before sleep, sitting at the edge of the bed, perform the heavenly drum technique, 24 strikes. This calms the nervous system and primes the brain for silence. After this, no phone screens. Here is something I want you to think about honestly, wherever you are right now reading this. After 40 years of age, the tissues in the neck and jaw begin to lose elasticity significantly, spasm takes longer to resolve, and the auditory nerve's tolerance for disrupted blood flow narrows. How old are you? Write in the comments below. I want to see which age groups are most affected by this, and I will use that data to tailor future videos directly to where you actually are. And the last thing I want to say, perhaps the most important thought in this entire video. Stop fighting the sound. Stop hating it. When you wake at 2 in the morning and hear the whine, your first reaction is anger and fear. Again, why me? That fear triggers an adrenaline release. Adrenaline constricts blood vessels. The ringing gets louder. A closed loop. Try shifting your relationship with it. The sound is not your enemy. It is your ally. An obnoxious, loud, exhausting ally, but an ally nonetheless. It is an alarm saying, hey, we've been neglecting the neck. We've had too much sugar. We aren't sleeping enough. Pay attention to me. This is your body's check engine light. When that light comes on in your car, you don't smash it with a hammer. You take the car in. Your tinnitus is a request from your body for proper care. The moment you begin giving your body what it actually needs, relaxation, correct neck alignment, the right micronutrients, the alarm will stand down. It will simply have no reason to keep shouting because you finally listened. Treating tinnitus is not a sprint, it is a marathon. Neural tissue recovers slowly. Give yourself time, not 3 days, 3 weeks of consistent protocol. Neuroplasticity, the brain's ability to rewire itself, works in your favor. The brain can learn to stop registering this sound, building new neural pathways that bypass it. But only if you are calm and consistent. Here is your clear, practical action plan for right now, immediately after finishing this. First, identify your type. Pulsing in rhythm with your heartbeat. Vascular. Work the neck and address blood pressure. Clicking and crackling. Muscular. Look at magnesium deficiency and stress. Monotone, constant whine. Sensorineural. Focus on nerve nutrition and biochemistry. Sound that shifts with emotions. Psychogenic. Begin with calming the nervous system. Second, screen yourself for the red flags. Ringing strictly in one ear. Sudden hearing loss. Vertigo with nausea. Any neurological symptom. See a specialist without delay. No self-treatment in those situations. Third, remove the aggressive factors immediately. No coffee on an empty stomach. Replace the high pillow with an orthopedic model or cervical roll. Discard the cotton swabs. Retire the vacuum in-ear earbuds. Fourth, build your biochemistry of silence. 1 glass of warm water first thing in the morning. Chelated magnesium in the evening. Active form B vitamins. Methylcobalamin instead of cyanocobalamin. Omega-3 fatty acids and quality fats daily. Fifth, perform the 3-minute protocol every day. Morning, ear rub and sternocleidomastoid massage. Daytime, Tingong point pressure on a long exhale. Evening, heavenly drum, 24 strikes before sleep. And always, always breathe. Long exhale over 6 to 8 counts. It switches the brain from threat mode to recovery mode. Sixth, revise your eating habits. Reduce sharp blood sugar spikes. Less sweets, refined flour, and constant snacking. Add fatty fish, avocado, walnuts, olive oil. This is not a weight loss diet. This is targeted nutrition for a nerve that must function like precision equipment, not like a stripped wire. And give yourself 3 weeks, not 3 days. Nerve tissue is not a muscle that bounces back in 48 hours. But if you are consistent, if you have removed the causes and given your body the resources it needs, silence will come. I have seen this happen hundreds of times over 15 years. Andrew slept through his first full night without medication 2 weeks in. Not 2 months, 2 weeks of systematic, consistent work. Tell me right now in the comments, describe exactly what you hear. A thin mosquito whine, a low industrial hum, the sound of ocean surf, the chirping of crickets, something completely different. Write it out. Write your age. Write how long it has been with you. I read every comment. Your case may become the subject of the next deep dive. Your doctor is not going to bring this up at your appointment. There is no financial incentive for the healthcare system to get you well and keep you that way. I'm Sam Waterling. I run this channel because I believe you deserve the unfiltered truth about your own body. If this video is useful to you, hit like right now. That one tap helps this channel grow, and it means this information reaches the people who genuinely need it. Subscribe so you don't miss what's coming next. We are building toward 1,000 subscribers, and every single one matters. Help Dr. Waterling get there. Subscribe, leave a like, and let's keep going.